Okay, it is Tuesday, January 26th, 2021. We'll call a meeting to order. Please stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Born and unborn. I gotta, somebody's gotta fill in for Jeff. Pardon? Okay, minutes and reports received and filed.
We didn't have any today.
Okay, Commissioner Committee liaison reports, upcoming meetings.
Let's see, we had a chamber meeting this morning, Apache Flats Business Association on the 28th, and United Way SEMO on the 28th.
I don't see the sheriff here. I think there's supposed to be a policy group call today at 1:30, so I'll check with them. And tomorrow I've got a Legends Bank meeting. Thursday we're doing a COVID press conference at 10 a.m. So that's all I've got. Any commission comments? Nope. Bids and contracts. Bid award and contract signing of 2029-29 generator maintenance.
For 2020-29 generator maintenance, we had 2 vendors submit RFPs on it. Our recommendation is going to go with Cummins. Greg's been happy with them in the past and wishes to continue business with them. And I think you guys have the bid tabs there.
You want to make a motion? You want me to make?
Go ahead.
I make a motion. We approve signing of the bid contract with Cummins for generator maintenance.
Second.
All in favor?
Aye.
Aye. Okay. Approval and signing of regional COVID-19 vaccine efforts contract.
I think we've talked about this a few times. This is a contract between the Cole County Health Department and Department of Health and Senior Services to be the Region F regional implementation team for COVID vaccine. So in addition to the Health Department working on this, Sierra has volunteered or been voluntold to help us. So I don't know how we can work out the logistics of the financials. It is for $128,000, and there's, we can use it for personnel time, but we could also use it to assist some of the vaccination clinics. Like I said, they're for all of Region F, so that's 13 counties, not just Cole County. But we have been given the contract to be this regional implementation team.
And I think really we ought to do it as much as you don't need any more work than you've got, but I mean.
We have a great group that is already pretty much servicing 8 counties, so expanding to the other, one's mayor. Anyway, expanding to the other counties, it really does make sense for our group to go ahead and take that on. And we have a great group that's working on it, so it's not like it's going to be my sole responsibility. And like I said, Chris White with my staff is going to help, and so is Sierra. And then we have staff from the local hospitals that have volunteered to be on it. And we have a great group of administrators in Region F, so it is going to be a lot of work. But as we've seen over the last few days with coordinating, or helping to assist to coordinate the Missouri National Guard vaccination sites, this team is very much needed, and because no one stepped up to do it within the region, we did.
Okay. I have a motion to approve and sign the regional COVID-19 vaccine efforts contract.
I second it.
I'm gonna make a copy for Sierra before I give it to you.
Oh, okay. Okay.
We need to vote on that, I guess.
Yes, all in favor?
Aye.
Okay. Oh, well. Do we have any unfinished business? Yes.
I have the report out from the emergency purchase last week of the freezer
I gotta see.
approved refrigerator.
Okay.
With all parties involved, Homer Scientific, which is where the health departments came from, we were able to use their account basically, and $43.27.33 with shipping is the price of the freezer. It's a refrigerator.
Okay.
Sorry, it's a refrigerator.
And we had done an emergency purchase on this.
You already handled this as emergency
Yeah.
purchase. This is just a report out, bringing back to you what we were spending.
Yeah,
Take any action?
I don't think
don't think
so,
so.
no. Okay,
She'll need a copy.
Thank you.
are you on here anymore, David, or are you leaving?
I'm gonna leave. I've got another meeting.
Okay.
Jessica's gonna be handling the sole sources.
When we had our conference call yesterday, Capital Region was very, very appreciative and had really good comments on EMS's support during their COVID clinics. So I want to publicly
Thank you. We have a really good crew there, and they're taking
Yeah,
it very seriously. So,
he said you guys were fantastic, so
all right.
thank you.
Thank you very much. Morning, gentlemen.
Okay, any other unfinished business? New business, accounts payable review.
I'd ask for approval of accounts payable pending review.
Motion to approve accounts payable pending review.
Second, all in favor?
Aye.
Aye. Okay, do we, CARES Act funding, we don't,
Not those
basically,
conference.
no subrecipient agreements. Okay, Michael Kute, Pringer Family Center for discussion of CARES funding.
Last year, you approved 8 iPads, and because of our court proceedings, I was short 1 iPad, and that's for our legal assistant in order to set up the court hearings on every other month than when we do have court. So this iPad would assist us with our Wi-Fi connections, and that calls its own state contract through OSCA, and that would be $567.90.
Is that what you had talked?
That's part of it, yeah.
Okay.
Is there additional CARES money requests besides that he will need? Is that a different item on the agenda?
It's right.
Okay, sorry.
Okay.
It's the second to the last.
Okay.
Hmm.
Just want to make sure we cover it.
Yeah, yes.
Motion to approve the
Okay.
iPad, was it iPad?
iPad, yes.
iPad request from juvenile.
Okay, I second. All in favor?
Aye.
Aye.
So we discussed previously about the Wi-Fi network at the Pringer Center and how heavily it's being tasked, especially with all the remote court hearing that's now happening. In the past, it's previously been handled just with off-the-shelf type devices. So I've sent everybody a quote as far as what it's going to take to create that and put that in a managed environment and stabilize that network. So, and the relevance of is I think what was that last week? You were trying to have a court hearing and it went out.
Right. Matter of fact, we were right in the middle of court, and the system went down, and we were on MediaCom, using MediaCom's internet, and it just totally went out, and we were down for about an hour before we could get back up.
So anyway, I spoke with Michael, and this has really been kind of in the works over the past couple of years, but it's really like needed right now because of the fact they are doing so much more remotely with the video conferencing and things like that. So I emailed everybody what the costs were associated with that, and I think this is a perfect application for the CARES funding, and I would ask that that be submitted for CARES reimbursement.
This is the one you fixed though, just by plugging it back in?
That's it.
See that?
Is this a monthly cost or is this a one-time cost?
This is a one-time.
One
cost.
time, yeah.
And how much?
Oh, we get it from.
And she really needs a copy of that.
Sure.
We aren't gonna have any CARES money left. That's,
So this is.
see, you're the last one, but I think we're out of
So
money.
this is the request itself. So this is for the networking, and then this is for the equipment and everything.
saying the equipment part is $836.43.
No, the services part.
That was the services
Yeah.
part, sorry. And the equipment is $7,336.62. And do we have, is that off a state contract, that equipment?
It is. It's off of NASPO contract pricing.
Yeah,
Motion to approve the request for the juvenile center networking equipment and services of 836.43.
And,
Equipment, 7,336.62.
I second. All in favor?
Aye.
Okay, Judy, Recorder of Deeds for discussion of CARES funding. I went down and looked at your, I'm a visual person, so I have to see what your,
I don't want you to get hurt.
Well, I heard you had extra money. No, I'm just kidding. So what I would like to request first is if you look at the additional cost, yellow highlight there, you'll see $665.50. There is an invoice attached with that. What that additional cost, it was necessary for us to do some cable and electrical runs when we set up a reference desk, marriage license desk. Additionally, this is an additional expense to CARES funding of a desk that we already have installed. So we had electrical there, but we didn't know we're going to have to run additional wiring to hook up our computers and everything.
So it's the only amount you're asking for is the six?
No, that's not all. No, that's just a request because we already have the table and everything installed. This invoice came as an additional expense that we did not expect. So I was just asking for that to be covered also with the CARES fund that we had additionally received. The second expense that you see is a new request, and that's just to add another window, to pay for another window that we can operate out of. Our office has been super busy. We have not slowed down. We've maintained constant patron assistance. I mean, we're always busy 52 weeks a year, but if we keep up like this, I'm gonna have to come back and ask for staff.
well, it's really modifying the window you've got, because you've got the one window that has the slide through, and then you've got the one that has just the lift up, so you're modifying that window, right?
No, we, initially, we installed a bypass window in March.
Yeah,
They had put in a temporary window. It's not stable.
okay.
And when they came back, after we received the CARES funding, and they came back to put in a permanent window, instead of them taking the temporary window back with them, because we paid for that initial temporary window, I asked them to put it in another window in case we needed it, which we did. So we have been using the temporary window, but it's not
So that's the one
stable,
with
it's
the
not.
little door, the little door that lifts up?
Right, but it's
Okay,
not
I
as
just wanted to make
functional
sure.
as the permanent
Okay.
window. So I would like to turn that temporary window into another additional permanent window, which is the second request you see. It's not like we're the collector and we have 5 windows. We only have 1.
More windows.
Was this an estimate, or was this just totals based on the first window you had put in?
I confirmed the estimate,
Okay.
yes.
Motion to approve the recorder's request, total of 4325.50
Total, yes.
total.
Second. All in favor?
Aye.
Aye.
Thank you so much.
Okay, oh, great one. public administrator for a discussion of CARES funding. See, Sierra, we're really getting down there. I'm sorry. I'm sorry. I got $27.32 left for you. Okay.
All right, good morning. So what we're requesting is 2 new laptops, one for the chief deputy and one for myself. The laptops will be used when we're out in the field and after hours. It will be our mobile office, if you will. We continue to get a lot of off-hour calls from the medical community, from clients, from community service organizations. What we're required to do whenever somebody calls or emails us about a client, we have to document what their response is. And that takes a lot of time, but with a laptop, rather than writing it all out, when we're not in the office, that's gonna make us more efficient. The other thing the laptops will do, when we're out in the field doing care plan reviews, which we do every quarter for the whole year, we can take the laptop, we can sit in the conference room, we can meet with the care provider and the client, we can get an update on their care plan, we can document all of that right on the spot. At the same time, we can update their client profile, what medications have changed, and other records. All of this is critical need-to-know information. And if we can use the laptops to do real-time capture of that information, we'll be a lot more efficient and a lot better off. So that's the purpose of the request for the 2 laptops.
What was the price?
So the price on the laptops, fully configured, is $3,687.08.
And that would be for 2 of them.
$3,687.08.
So Ralph, do you think this is mainly due to COVID-related things, or is this more to help you do plans and things on the go?
Yeah.
We need to be a little careful. CARE still has to be a COVID-related expense.
Right. A lot of this is related to COVID, yes. I mean, I'm still trying to get into facilities to make my statutory required visits, but they're still closed. And so what the facilities are doing are Zoom calls, of course, and they're asking us to stay away until further notice. And oftentimes I can do Zoom calls after hours to catch up on my caseload, and that's where the laptops come in as well.
So you're doing a Zoom with your client?
Oh, yeah.
Okay,
Yeah, I've been doing that since I
Okay.
got on board in July.
okay.
And we're continuing to do those. Those aren't gonna go away, but I still have to make annual visits
Yeah.
at a bare minimum to my clients.
Well, sometime whenever they open up again.
Yeah, some have opened up and I've been able to go there as long as I social distance. But most of them are still shut down.
Yeah.
And I got a second request. I'm requesting an up-to-date laptop, not laptop, but desktop, that has the audio visual so that it will support Zoom calls from the office. Right now with our desktops, we don't have cameras. And whenever somebody calls in for a Zoom call, they're always asking to see the public administrator, especially the client. They want to put a name with the face. They want to know who their guardian is. And I have those almost every day now. Right now, I'm doing the Zoom calls on my cell phone until the battery goes dead.
We just use Old Great One, and he hooks up that temporary camera.
Yeah.
So,
And he's got a quote here of $1,174.48.
But that, again, that would be used by not only me, but my chief deputy, because we split care plan reviews, most of which right now are on Zoom calls.
So Brian, could they use a laptop as their desktop or no?
So this was, when Ralph and I were talking about, this was gonna be like a common workstation they were gonna use. So, I mean, I guess you could push a laptop over there, but I don't know so much about.
I mean, the idea on the laptops is to keep them at home so we can use them remotely, not have to bring them in every day.
And this is CARES related as well.
Pretty
Okay.
The main
much,
purpose is the Zoom meetings.
yes.
So this basically how what we have in the commission, we set up a video conference center. So this would be something similar to what they're doing, only it would just be like a workstation, kind of like
Okay.
what you would have in your office or something.
Right.
But it'd be for like their staff.
I'll make a motion to approve the request for the two laptops of, total for those two laptops, 3687.08, and for a desktop of 1174.48
I second.
for the public administrator's office.
Thank you.
I second. All in favor?
Aye.
Aye.
Thank you.
Could I interrupt just for a second to ask Kristen, do we have sort of a countdown going to when we get, or to
Debbie sent
Debbie?
you an email this morning, I think, that had where we were before any approvals today.
Yeah.
That was this morning?
Yes,
Okay.
right before we walked in. Some of those are estimates yet, but some of them will change a little bit with the refrigerator I got today.
So we started this morning at 124, and we've reduced it by what we've done so far today. Okay. Whoops.
Whoops, I'm sorry.
I do want to just go back to the recorders. She's not in here yet, but whatever vendor she's talking about using, I need to make sure that's within the emergency purchase or the 90-day without bidding, or otherwise you can call it an emergency purchase if you guys want. Or otherwise, I'll have Jessica get with Judy to find out who that vendor is and to make sure we're not over that threshold that we would have to bid. It's whatever pleasure you want. Either you're gonna have to call it an emergency purchase today, or we'll just have to check to see if that would put us over the limit for bidding.
So we were using that vendor for multiple items for COVID, so, I have a feeling we are over the bid limit at the moment. I think the health department is sure they were, right? I think they're gonna,
Although, part of that was, you know, they put them in the first time and they're not working right, so I don't know how much the additional
Yeah.
expense is gonna be to.
And when we were using BKD for the purchasing and doing all that, they had an emergency clause there. We don't really on these type of purchases, so I'd rather you guys call it an emergency than if you want to, for her to go.
I would probably call it, I went down and they've got the one window that's kind of like what the collector
So,
has.
Just make a motion to approve it as an emergency purchase.
All of what we've done, or
Just
Judy's.
recorders,
Most of all of this other stuff is on state contract.
right.
the recorders.
I have a motion to treat the recorder expenditures as emergency purchases.
I second. All in favor? Aye.
Thank
Okay.
you.
Okay. Sierra.
So we have a large cooler at the ESB, and it hadn't been tested for quite some time. It was tested, it wasn't working adequately, so we had a tech come in and fix it in the event that we had a mass casualty event, and we needed to store bodies or cadavers, or however you want to word it, at the shop. So we were going to go ahead and shoot for CARES Act funding to cover that. I just recently received the bill. You'll see that, I guess I gave you guys, oh no, here it is. It's $2,272.58, and it is up now to working order.
Yeah, we would not have fixed this if it wasn't for COVID.
That's
And
correct.
I think at that time, we were hearing from some of the funeral homes that they were overflowing, so this is definitely CARES related.
Is-
Okay, you want to let? I make a motion, we approve the contract with Air Systems
Systems
for
LLC.
$2,272.58
say you happy, it's a
for
great call.
repairs to the cooler at the Emergency Management Center.
Second.
All in favor?
Aye.
Oh, you did? Okay. That's good. I'll give you a copy.
Thank you.
Okay, signing of surplus title.
Okay.
Which vehicle is this?
Well, this is the van from the juvenile
Okay.
center. I will be talking to Jessica today. As soon as we get our insurance check, I'll be talking to Jessica. And I talked to Michael a little bit this morning.
Yes, yeah.
About the replacement.
I think we need a motion.
Motion to sign the title of the van from the juvenile department.
Second. All in favor?
Aye.
Aye. Okay.
And do you have any problems with that, as us looking for a replacement for this van?
No.
Okay.
No. Okay. Sole source ad approval for First Watch.
This was approved and purchased last week for EMS. It's a software that they use. It needs to be ran as a sole source ad. It was $12,000. So I'm asking for approval to run the ad in the paper.
Motion to approve sole source ad for, this is First Watch?
First Watch.
First Watch.
Second. All in favor?
Aye.
Aye. Sole source ad approval for Priority Dispatch.
This one was approved last week as well to purchase for EMS. It's a software and a performance review that they use. The total was roughly around $28,000, and it's gonna need to be ran in the paper as a sole source ad as well.
Motion to approve sole source ad for Priority Dispatch.
Second. All in favor?
Aye.
Discussion and approval of Cole County Health Department overtime policy.
I sent this policy via email. Do you need another copy? Are you good?
I can pull it up.
Okay, I'll give you my copy. So we were just talking about trying to establish provisions related to overtime for exempt employees. This is only during public health emergencies. This is not something that we would have all the time. But it will allow those exempt employees that would not normally get overtime if they physically work more than 45 hours in a work week, they could accrue comp time, basically straight time, not time and a half, to be used. We did set a limit that they could only accrue up to 120 hours, and we did say that it could be the commission's discretion whether the comp time would be allowed to accrue or could be paid out to the employee at the end of the month. So a very limited policy, but it does help those staff that are exempt employees and working in excess of 45 hours a week. But like I said, only during the public health emergency times, and I think it only applies to 4 staff. Is that correct, Debbie? 4 or 5.
At some point, will the health director say this emergency's over? Is that a?
I think the governor's
Oh,
declared
I'm
it
sorry.
as a public health emergency, so we would probably go by
The state mandate?
state mandated public health emergency.
Okay.
And I know the city has also declared it. We had at the beginning, and we never lifted it, so I'd assume we're still under that public health emergency status.
So when the state said it, you seconded the motion, basically? Is that right? And so,
But if we felt that our part of the public health emergency was lifted, we could say, I could tell, in consultation with you, we could say health department employees were no longer operating under a public health emergency. This policy is null and void. We could do that at any time.
okay.
Did you have to do that to open the EOC, activate the EOC?
We did.
Yeah.
We did, had to declare it a public health emergency to operate the EOC. The city and the county had to, not me, the city and the county had to.
And you were okay with this proposed policy, right?
Can we make sure that that wording's in there as far as that it's a state mandated public health emergency?
I
Is
can
that in
revise.
there?
All I said it was declared. I said during events that are declared a public health emergency. I didn't say who declared it. We can add that if you would like.
That's clear for the
Well,
person
you
doing
could
the
have
payroll.
situations, though, where in Cole County, you've got a public health emergency.
And it's not the whole state.
And it's not a statewide thing.
That's up to them. If you don't want it to be based on the state declaring it.
Right, we perhaps wouldn't be locked into the state. I mean, the governor could declare it for a county up in the
Well,
northwest corner.
Right. If there was flooding or something, he could declare an emergency. Like I said, it wouldn't be public health, but he could declare a public health emergency for the boot heel, and we wouldn't be affected. So
Right.
at that point, it would be not affect us. So
Well, and like the Joplin tornado.
Right,
I
that was-
imagine Joplin
Oh, yeah.
itself declared a public health emergency.
correct.
But the
It had no effect on
governor
us.
did not declare it statewide.
Correct.
So, under that scenario, then, you know, it would be a local deal. Say if our tornado resulted in a whole lot more loss of life
Mm-hmm.
and human destruction.
Right.
So what would be an example though where it wouldn't be a state declared, but it could be a locally declared?
Well, if we had the tornado and it resulted in a big loss of life here, or
I know,
we
but
could
that
have.
would still be state declared, it would just be a
No.
limited area, or it wouldn't?
No,
No.
Maybe, maybe not.
Maybe not.
not
Yeah.
necessarily, no.
Yeah.
We
If-
could have a huge outbreak of something here that we would declare it a public health emergency, and the rest of the state could not be having that outbreak.
Okay.
Say some
Yeah.
student
Measles,
came
I
in
mean,
with Ebola.
yeah. Oh gosh, don't say that.
Remember
But yeah,
that?
I know. I remember those exercises. I'm not sure. Yeah. So yeah, we could have a public health emergency here, and the rest of the state could not.
Well, I just need clarification of who gets to decide that.
Well, it would be the
County commission.
commission, yeah, we would, yeah, it's not gonna,
Well,
Wouldn't
should we
necessarily
insert,
run We can.
after the first comma there, insert
As declared by the
county
We can
commission?
do that.
yeah.
So with that addition, revision, I move that we adopt this provision, policy provision for the health department employees, so covered by the provision.
Overtime, yeah, for overtime exempt employees,
Yes.
yeah, I second. All in favor?
Aye.
Aye. Okay, discussion and approval of Health Department ICS 100 and 700 course certifications during pandemic.
So, Sheriff Wheeler actually brought this to my attention, that my staff need to take the ICS 100 and 700 courses because, you know, when we're operating mass vaccination clinics, you need to follow the ICS structure, so there's a definite incident command, you know, everyone has their positions, and all of our staff have been required to take that, and none of them have, and he suggested that we compensate them for taking that course. So I think we talked about it a little bit last week, so I'm asking for permission to require the staff to take it and then to compensate them a one-time payment for taking that course.
Yeah, there's 9 employees here.
Right?
Can we just pay for the course instead of paying them directly?
The course is free.
Course is free, you're just paying them to extra
take-
money to take the class.
Mhm. It gives them more certifications.
It's the ICS 100
Yeah.
and 700 course.
Yes.
Yeah, NIMS.
All right,
And
what-
how many hours? I mean, I don't know, how am I supposed to do that payroll?
The sheriff suggested we just give them a lump sum payment for taking the course. We had some discussion about that last week, and it was decided that they should each be given $2,000 for taking the 2 courses. We talked about it during closed session.
What's the approximate amount of time it takes to take the course?
I don't know. I know that 100 is approximately 2.5 hours, but it's been a long time since I've taken 700. I will take them again, so I don't know how long it'll take. And we will ask them to do that on their own time because we don't have time during the workday to do that.
Are these numbers that the sheriff has used?
The 100 and 700?
Well, no, the compensation for doing
Well,
this.
he actually suggested a little bit higher amount, and
Yeah.
we talked about that last
Okay.
week.
Here's his,
All right.
that was his.
Right. And if you feel like another number is more appropriate,
I think, $1,500 or $2,000
it's your decision.
I'm fine with either one of those, so.
Is there any stipulation on it? If they leave, they take it back or anything?
Well, everybody leaves eventually, so leaving within X weeks or X months after the certification is subject to reimbursement to the county.
We could do that. Say 6
Is
months
there
or
a
year.
fair number of months that it should,
I'd say at least 6 months or a year. That's also your decision.
I'm good
Is this
with
a
it.
yearly certification?
1 year?
No, it's one time.
Do we want to do it a year?
That's fine.
Yeah. We'll make it a year.
Okay.
Jill, are you gonna work up something that the employee will have to sign?
We can work on that.
Mm-hmm, we can.
I have samples, like the sheriff uses when he sends
Yeah,
jailers.
and they will have to show us their certificates, obviously.
And Matt has, I've done up some for Matt too.
So is this a modification of
Do you
our
get
policy?
prorated?
or-
Yeah.
I know in the other
If
circumstances,
you want, I
it
can make
gets
the motion.
prorated
A
depending
motion,
on the
make a
amount of
motion to
time that you would
compensate 9
stay,
staff
what you would have to
members
pay
I'd
back.
have
for
to go
completing
back
that
and
if you
look at
want,
Kristen offhand.
and that
It was
way,
I thought I seen one of them, it was a flat.
yeah.
I
You
think
just
if
have
they
to
leave
stay.
within a year, they have to pay back.
Right.
I think the sheriff's is like 3 years.
We can work up the agreement, but I say we make them stay a year or they have to pay back.
Yeah.
And then it's up to you
So-
whether you want to do 15
So
or.
Jill, could you do that as like a stipend that you divide out over the year?
What do you mean?
Instead of giving them the lump sum, she's
Instead of
saying
giving a
spread it
lump
out.
sum?
Well, I mean, it's a payment for achieving,
Cause it's gonna have to run through payroll somehow. They're gonna have to report it. If you're paying them that lump sum, it's gonna have to run through payroll
I mean,
somehow.
I don't know why you couldn't do it on a payment plan. Installment loan, you know?
I mean, that would avoid it being paid back as well. I mean, you would get so much a month up until you left. If you stayed the whole year, you would get the whole amount.
I'm not sure if it qualifies as a stipend to where it wouldn't count towards their overtime rate or anything like that. But if it's a one-time payment, it should qualify for affecting their overtime rate.
Yeah, I don't.
So let's do it
it's-
that way.
I mean, those are accounting deals. I don't think there's anything illegal about it.
As the number cruncher, bean counter, wouldn't you just rather pay it and get it behind you one time?
I think it's just the off chance that people do leave the trying to recoup or.
Couldn't we say we would take it out of their?
Well,
last
but,
pay?
but these are all, these people are all compensated enough that, but their final check, disbursement for their compensation can be adjusted. In other words, they're not going to get ahead of you. We have a delay in payment of payroll. So if somebody leaves, they still have another check coming, and we could catch them, if that's the terminology here. So I don't have a problem of paying it one time.
That agreement that they signed.
We will-
But yeah, we have remedy, we have a built-in remedy. The risk,
And as long as they sign it and understand that it will be coming out of any, last paycheck or whatever. that's
Vacation
good.
time they're due.
$2,000, that's not going to, that's a big amount on one 2-week pay period.
No, but
I'll
that's,
try my best to get whatever we can get back.
well,
Yeah.
And they
it's a
should-
little unlikely that, I mean,
Assuming-
Yeah.
I would think looking at
Okay.
these names, I don't think, I make a motion that we compensate 9 staff for completing the ICS 100 and 700 courses. The courses must be completed by March 1st in order for the staff person to receive a $2,000 compensation. And by receiving that, they must stay with Cole County Health Department for 1 year.
Or payback.
Yes.
Got it.
Second.
Any more discussion? All in favor?
Aye.
And Jill and I will work on an agreement. You said you have a sample?
Yeah.
That'd be great.
I've done them for others.
Okay. And I will make the adjustments to that policy too. So, thank you.
Okay.
That did get to have a limited agenda.
We just had a lot of things on it.
Do you want to keep?
I'm sorry.
Where is John? He's always.
I don't know. I was going to ask him about our policy.
Because we're trying to do a walkthrough for the National Guard vaccination site. Trying to
Yeah,
pin down
that's-
those details.
All
What are
bad.
you thinking? The link.
Yeah, do we have any other business to come before us today?
Motion to recess until 4:30?
Second. All in favor?
Aye.